In the modern era of science and medicine, there is one disease that continuously has health researchers and providers extremely tentative to treatment. Cancer, arguably one of the worst health epidemics of our generation, remains a prevalent and serious disease across the entire world. Cancer, by definition, is any malignant neoplasm that invades surrounding tissue and can metastasize to other locations. Neoplasms are also known as tumors, the physical presence of cancer, which are uncontrollable abnormal cell growth. Such uncontrollable growth hinders the homeostasis of the body, throwing multiple body functions off balance. Cancer can be influenced by both external factors, such as pathogens and unhealthy lifestyle, as well as internal factors, such as genetics and immune system issues. It is the second leading cause of death in the United States, behind heart disease, while also being the sixth leading cause of death in the world. In fact, the Center for Disease Control confirmed 14.1 million cases of cancer globally in 2012, and expect by 2035 that this number will more than double to 30 million. In the United States alone, the American Cancer Society predicts that about 600,000 individuals will die from cancer in 2015, while 1.7 million new cases will be confirmed. Patients diagnosed with cancer face many challenges within their physical health. The many effects of cancer range from internal bleeding, unexplainable weight loss, uncontrolled bowel movement, loss of function in the affected organ or organ systems, death, and many, many more. Even chemotherapy, the most effective treatment to date, has side effects that are detrimental to the patient's health, including extreme fatigue, nausea, loss of appetite, depletion of nutrients and proteins, sleep deprivation, blood loss, and any flu-like symptoms. Cancer patient lives are changed forever, and they have to adjust their lifestyle to practice methods that will not only benefit their physical health, but mostly their mental health. Diagnosis of the disease is enough trauma for patients to exhibit high levels of stress, anxiety, depression, or fear of impending doom. The strenuous hours and side effects of chemotherapy are infamous for causing emotional distress in patients. Added on to this is the stigma that cancer has no cure, so the patients believe that they will never be cured and start to lose the will to live. Even if patients are able to get through the doubts and distress of diagnosis and treatment, dealing with the symptoms alone can take a toll on their mental stability, as fatigue and sleep deprivation can greatly influence mood. Emotional and mental problems majorly impact a patient's quality of life and can cause the physiological state of the disease to progress even more rapidly, ultimately resulting in a deteriorating cycle that starts with patients becoming disabled of simple everyday abilities, such as walking or getting out of bed, and ends in their ultimate death. Chronic emotional strain of the mind can cause a physiological shift in corticosteroid hormones that breaks down lymphocytes, a type of white blood cell, therefore weakening the immune system. This allows for the cancer to spread easier and shut down other organs of the body, as well as making the body susceptible to many other diseases. On top of a weakened immune system, stress and emotional strain inhibits the digestive process, which not only deprive the patient of essential nutrients, but can also cause stomach ulcers, further complicating treatment and harming the patient. Considering the health implications, the practice of meditation is a worthy solution to relieving cancer patients of many of their problems. Unfortunately, there isn't evidence that supports the claim that meditation exercises are able to directly alleviate the physiological symptoms of cancer. However, there is plenty of research and evidence that suggests meditation is effective in combating stressors of the immune system related to cancer diagnosis, including anxiety, depression, and fatigue, which can physiologically relieve the body and allow for an easier healing process through medical intervention. In order to alleviate the psycho-emotional strain, it would be most appropriate for mindfulness-based meditation to be used as a therapy for cancer patients. Mindfulness-based meditation is the state of attention to moment-by-moment experience and the non-judgmental acceptance of the experience. Mindfulness meditation is beneficial in the way that it allows for individuals to acknowledge and be mindful of the multiple issues that are present and learn to cope with them rather than dismiss them. For cancer patients, this allows them to become accepting and mindful of what their physical condition is and what it entices. That way, they can focus on treatment and not stress their body out, allowing for optimal healing. Mindfulness meditation has physiologically been linked to decreased blood flow to parts of the brain that control decision-making processes, which allow the individual to keep a clear mind and recognize their state of health. Interestingly enough, increase in melatonin production has also been shown, which regulates blood pressure and the sleep cycle. This allows relief of hypertension, sleep deprivation, and fatigue. There are many specific backgrounds of mindfulness-based meditations, branching from Buddhist, Indian, and Chinese practices, but the meditation that has been mostly used in cancer patients is Xining Qigong. Qigong is a 5,000-year-old tradition Chinese therapy that uses physical activity and meditation to heal the body. In Chinese tradition, it is believed that physical and mental illness is caused by the blockage of energy in certain parts of the body. Qigong, Xining Qigong, is a specific medical Qigong exercise that utilizes the free flow of this energy, known as qi, to harmonize the health of the body and mind. Although the spiritual aspects of the exercise won't be implemented out of respect for other patients' beliefs, the physical and mental aspects are the vital factors that contribute to healing. For the exercise, an individual moves their body in yoga-like poses, controls their breathing and posture, and interacts with the environment to create physical stances in a mindful state that reduces stress. It is very similar to yoga, except with an equal focus on the mindfulness aspect and the physical stances. Stances include standing straight with arms stretched out to their farthest point, balancing on one foot and enclosing hands, and bending knees while enclosing arms. Xining Qigong creates a hypothalamic response to the brain that results in homeostasis of both the sympathetic and parasympathetic nervous system. Oxygen production is increased, allowing for healthier tissues and cellular function in patients. The more healthy cells that are present in the body, the easier it will be for patients to heal and face treatment. Some of their healthy cells are also hindered in chemotherapy treatment. Decreases in pain, sleep deprivation, and fatigue are also tied to Qigong practice, as it mimics and enriches sleep brain activity during sleep. As a majority of individuals with cancer are hospitalized or treated in a clinical setting, it's most appropriate for a Xining Qigong meditation program to be implemented in hospitals and cancer treatment centers. Even those who are not hospitalized are still given the opportunity to attend, simply by checking into hospitals for just as if it were a chemotherapy session. Instructors of the meditation exercises include certified meditation instructors, occupational therapists certified in meditation instruction, and even nurses certified in meditation instruction. Instructors meet with all capable cancer patients in a common room of the hospital and provide at least one 60-minute session every other day, which is found to be the recommended minimum that is most effective. Patients who are bedridden and physically unable to participate in the sessions also have the opportunity to participate in meditation exercises, as a private instructor comes to them and provides an alternate mindfulness meditation exercise for the same amount of time that includes stretches and poses that are within their range of motion. The Xining Qigong meditation has minimal risks of injuries or stress on the body. The physical stances are not strenuous, so a patient does not have to be muscularly toned or have a high level of athleticism in order to participate. There are no environmental or demographical limitations to the exercise. It is not specific to any race, gender, or setting. Though meditation is used in certain religious practices, Xining Qigong can be practiced without divine qualities, so there's no confliction in personal beliefs. This means that meditation can be performed anywhere by anybody. As long as an individual is physically able to imitate the positions and instructions given by the instructor, as well as mentally focused on the objective of the meditation, they have full ability to experience mindfulness meditation. Again, meditation can't fully relieve cancer patients of their tumor. Therefore, it is not a direct cure for cancer and should not be substituted as such. Chemotherapy has always been the most effective method to date in treating the physiological defects. However, there is enough evidence to suggest that meditation is legitimate treatment to relieve the effects of cancer, both physiological and psychologically. Xining Qigong is an alternate, holistic therapy that has been effective for thousands of years, and its effectiveness as a treatment is why it's been around for so long. If it can tackle almost all the issues that arise from cancer, then it is a method that can be implemented in cancer rehabilitation programs all over the world and rid patients of a lifetime of pain and suffering.